toppers, right? Do you waste your time, or you are like, no, 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 no wastage your time? So what's the reality?
I mean, definitely. I mean, there are good days and there are bad days. So, I mean, what works for me is that if I have a bad day, the point is that instead of guilt tripping yourself and feeling guilt over that, you can rather use this as a motivation to make up for that the next day.
So how is that like overall things? You are from which college, dog?
I am from Government Medical College, Trivandrum.
Trivandrum. Okay, great.
From Kerala. I also live in Trivandrum.
Okay, great.
Yeah.
So how's the COVID thing now there in Kerala? Cases are on a decline, I heard.
Yeah, it's on a decline. I mean, it's much better than it was like a couple of months ago. I mean, there are still cases, but I mean, it's pretty much normalized now. So
yeah,
everyone's back to normal.
Everybody would be going out now without masks.
Pretty much, yeah.
But nothing like a third wave, or like, as people were saying, there would be a third wave coming. So like, what's
so far nothing. I mean, the cases haven't really started spiking again. So it's pretty much on the down low. But I mean, hopefully there isn't a third wave.
There should not be. No, true. So, yeah, even the hospitalization stay, like we were wondering that maybe in the third wave the virus will be more aggressive and we'll have more hospitalizations or prolonged stay. I think people, because they have taken the vaccine, so most of them are not getting hospitalized. And even if they are,
I mean, the vaccine does play a very important role in that. Yeah, that's definitely there.
So, Doc, you just completed your MBBS? Like this was your first attempt?
No, this was, I mean, I finished my internship in January this year.
Okay.
And I had given one attempt at the INI-CET last November. I got a rank of 239, but I was hoping on taking something more clinical, so I could not really get through that attempt.
Okay.
And then in February this year, I started my preparation properly. And I gave my first INI-CET. It didn't turn out really well. I got something in late 700s. But then I was able to get back on track, and I gave the NEET, for which I got an all-India rank of 51. And now I gave this INI-CET also shot, and I got a rank of 23. Yeah.
So how are you maintaining this tempo? I mean, you're getting into double-digit ranks, you're getting into top 100. So like, normally I'll put it like this: if somebody gets into top 100 in NEET, then you will say, okay, fine, I am not gonna study anything more. But you somehow, were managing to press on the reset button and starting the race again, and then again going into a double-digit rank. So how did you keep up the tempo? I mean, it's difficult, I think.
I mean, yeah, I mean, most certainly it was really difficult, because I mean, when you have something assured in your hand, you really don't have the motivation to go forward. But I think a lot of it has to do with the NEET counseling getting postponed also, because that wasn't reaching anywhere. So anyways, the counseling in the Supreme Court date was supposed to be after the INI-CET exam. So and besides, Central Institute was always a dream of mine. So both of them just aligned at the same time. So I was able to prepare for like 1 or 2 weeks prior to the exam just to brush up the topics. And thankfully, that was enough.
Okay. So everything, the whole universe conspires to set things right when they have to be, right?
Exactly.
And when things have to go wrong, they go.
Yeah, maybe that was the plan all along.
True. No, so
yeah, exactly.
That's the height and peak of your career to get into, I mean, top 100 ranks in one of the 2 most coveted exams in India, and your smile says it all.
Yeah.
I don't know whether
thankfully,
that's a look of relief.
More relief than happiness, because this ends here. So I mean, no more exams, and yeah, that's definitely there.
So, Doc, like if we talk about this particular NICT, did you find anything different from the previous ones? Because I did speak about I did speak to a lot of students, and they said that this one was more difficult as compared to the other one. So, like, let's have it from you. Like, what is your take on the same?
I mean, having written all the INICETs that have been there so far, I mean, in my opinion, also this one was pretty harder than the last two ones.
Okay.
I think the hardness part of it is more to do with the the unpredictable nature of the exam, because I think it was more clinically oriented. So it's becoming more and more clinically oriented. I mean, it's always been clinically oriented, but I feel the stress on the clinical aspect of it is getting more and more. So I mean, I think we are just getting used to that pattern. I mean, the question, it's not that we don't know the topic, but I mean, it is presented in a way that it seems a bit surprising at first, but once I feel like if our concepts and bases are strong, I guess we'd be in a position to tackle it. So more than hardness, it is more of the new kind of questions, but I guess it depends on the presence of mind and our fundamentals then. So I felt it was more dependent on that.
Okay. And like, let's compare the pressure on the exam day. Like the day when you were going
Yeah.
for NEET, right? The day when you
Yeah.
went and wrote the NEET exam and NEET PG, and the day you went and wrote this INICT. Why I'm comparing the two is because, this time when you were going for the exam, you already had secured a rank. So I think you would be a little
Yeah.
more relaxed. So, I mean,
Relax. Yeah.
apart from that, like what differences did you notice when you actually went for the exam, when you sat down in front of the computer, like did you notice any difference in your heart rate, pulse rate, sweating, or general overall
I mean,
view? I mean, how you went
definitely. I
about?
mean, exam is still next. So I mean, an exam is still an exam. So, and plus, because I mean, the nature of the exam is such that it is more demanding,
True.
probably than a NEET exam.
Mhm.
And obviously, the competition is at stake. The number of seats are lesser. So, definitely, the panicking element always sets in. But again, because I mean, like you very rightly said, because I had something at hand, um, all the stress wasn't there. And I think one thing I've learned from giving the last INICETs and NEET is that no matter what your level of preparation is, it all boils down to what happens in the exam, because our presence of mind, our calmness and our composure to recollect. I mean, even though it might be from our MBBS days, but I mean, in that presence of mind, if we are able to recollect things, that's all that matters. So, from what I've learned, I've realized that the calmness is the key to solving, as in, or solving, or getting a great rank. So I try to implement that also. I mean, so yeah, both of that together, I feel like it was much better than the previous ones, because I made sure that I was calm for that also.
So, like when you're studying on a daily basis, I think definitely at one point of time, some saturation point is reached where, like, beyond a certain limit, like suppose you're studying 12 hours every day and you are able to achieve that target. Let's assume, like, 3 days, you're
Yeah.
able to achieve the target. Like on the fourth day or fifth day, there's a possibility, and this happens with all doctors, that a saturation point is reached. And then one says that, okay, I'm not gathering anything, to hell with studies. I cannot study anymore. So I think everybody needs some small breaks in between. So, like, what are those small things that Dr. Hariprasad was doing to unwind himself when it really became very overbearing?
I mean, yeah, I mean, like you rightly said, I mean, starting off with the preparation, you feel like you're invincible. I mean, you can go hours and hours at end, without no breaks, and but then later on, you do realize that not I mean, our productivity basically just takes a fall. I mean, if that break is not there. So earlier on in the days, I mean, I used to feel that the productivity was slow. So then later on, what I used to do is that I used to make sure, I mean, at least 1 hour of just time to take off, and just, I mean, even if it's as small as just going and speaking with your parents, or if it's like
Okay.
speaking on the phone with your friends, and or even just like watching a movie in parts. I mean, you can
Yes.
take like half an hour breaks, and
Okay.
split it
But
throughout the
is it
day,
is it
and
is it really possible to watch a movie in breaks? I mean, you can control yourself that you watch half an hour, then you say, okay, I'm not gonna watch it, and then
I
you're
mean,
gonna watch it.
I mean, that definitely comes with practice. So, I mean,
Okay.
initially it's a bit hard, but then again,
Okay.
when we are starting preparation, we are more at ease. So point of time, it isn't a big issue. But I think towards the time of the exam, the tension also plays a part in, us
True.
stopping exactly when we want to stop. So
Mm.
definitely, yeah. I mean, breaks are really a must. I mean, that's one thing I would like to stress upon. Without breaks, I feel like there's no point, because our productivity is bound to fall at some point of time. So that break, keep that momentum up. So that's
But
what I
but
feel. Yeah.
but suppose that break gets extended, then
Yeah.
we start thinking it's a time wastage. That's a big problem with toppers. No,
Yeah.
they always talk of, oh, I'm wasting my time. So what to do about it? I mean, I get these queries, sir. I waste a lot of time. So let's have it from you. I
Okay.
mean, like, does this happen with toppers, right? Do you waste your time, or you are like, no, 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 no wastage your time? So what's the reality?
I mean, definitely. I mean, there are good days and there are bad days. So, what works for me is that if I have a bad day, at least, at the end of the day, I do realize that, okay, fine, I have not achieved what I wanted. And it's fine. I mean, the whole point is that instead of, guilt tripping yourself and, feeling guilt over that, you can rather use this as a motivation to, make up for that the next day.
Okay, acceptance.
So, yeah, acceptance, exactly. I mean, you have to, there is no point in pining over that you lost the day, because, okay, fine, that has happened and you can't really go back and change that. So, and plus, the fact that you haven't achieved your targets is enough motivation to, work slightly more, or spend more time the following days. So definitely, we are humans, so we are bound to waste time. But the whole point is not to get fixated on that, and to, to use that as motivation to work extra the next day.
So being a topper, like I know you have all the strengths, right? But what are your inherently weak subjects? Let's have any, and even if you can relate any funny story about some weakness in a particular subject, we would definitely love to hear that from you.
Definitely. I would feel. I speaking on behalf of a lot of medicos, I would say SM would be my
Okay.
Achilles tendon.
Okay.
Because I feel like more than it is a bit of a dry compared to the,
Okay.
and with a lot of national schemes, policies, and stuff like that.
Mm-hmm.
It definitely, we get saturated much faster than with the other subjects. Also, it's really vast. So that was always a problem for
So the
me.
truth is, toppers
Um,
also have weaknesses.
yeah, definitely. There are
Okay.
certain subjects which I really fear. Yeah, no matter how prepared you are, there's always that, that element of fear.
Element of
Like
fear. That's
SPM,
the truth. That's the truth. That's the
yeah,
naked truth. I mean, there are some subjects which, howsoever well you prepare, you at the end of the day,
exactly. Yeah.
when you see that subject, no, something overcomes you, and you are like, oh God, will I get it right? Will I get it wrong? So, I thought I should ask you, because everybody will think that toppers are
Definitely,
ideal.
sir.
So, apart from the
No, no,
PSM,
no, definitely not.
okay. So,
Apart from PSM, I would say um, uh, ophthalmology.
okay,
Ophthalmology is fun. It's fun to learn, but I feel like for a small subject, there is a lot of subject matter in that. So
exactly. Data.
compared to other short subjects where the amount of material is less, Opstal I feel is a bit more vast. So no matter what you learn, at the end of the day, the questions can come from any topic. So
Exactly.
the risk benefit ratio is a bit skewed with Opstal. So for that reason, I feel like Opstal is
True.
also a bit of
True, true,
a
true.
scary subject.
So what did you deploy, like once you realized that, okay, these are my weaknesses, like what really you did extra for these subjects? Like, did you dedicate extra days, or like you used more sources? Like, I mean, like once you identified a problem, like
Yeah.
what was your approach for that to solve this problem?
I mean, I would say the approach was twofold. One, definitely, I wouldn't keep it for the last days. I would make sure if I have
Okay.
like a
Mm-hmm.
20-day gap, I would make sure I do this in the first days itself. At least the first reading, and so that I have just I just have to revise it towards the end.
True.
Having gone through that in the first itself, gives me a bit of a relaxation that I've gotten past the the hard ones initially. So
True.
do that and make sure that I just revise through these topics towards the end. And because these subjects are vast, another thing I used to do is that, okay, I mean, there is a limit to what we can do. So I used to, just look at the previous year papers and, just mark the important points,
Okay.
and just the important topics. So then, get through those important topics for, the must do topics first. And then if you have time, if time permits, the other, the less important topics, but, that could possibly be a question. So, prioritizing topics in that subject and making sure that I'm doing that subject right in the beginning, so that I can just revise it quickly the day before the exam. So I feel like doing these two things, help me get through these two subjects. And any other subject that was hard.
Oh, great, great, great. It's a very valuable tips that you're giving. I mean, facing the problem head along, identifying what you can do about it, then selecting the topics from a retrospective method, going through the questions. So
Yeah,
that's a very pertinent and a right approach. So it's been great talking to you, Doctor. I mean, we can continue the whole day about it, but then we
I mean, yeah.
anyway have to keep it short. So I thought that at least we listen to some words of wisdom from your side, which will be help for everybody else. So any shout out to your juniors? I mean, they would be
I mean,
bombarding you with messages or inputs.
I can definitely relate to that because I was a junior once, and I also looked up to my seniors for valuable advice. So, I mean, if there's a few things which I would say to a junior would be, I mean, first and foremost, it's important that you trust your sources and trust
True.
yourself, because that's what I mean. Setting out, or just being into an exam preparation mode. That's what you have to realize. I mean, you have to believe in yourself. I mean, there are certain people might do things a different way. I mean, I might do things a different way, and that need not work for everyone.
True.
So what matters at the end of the day is, you listen to different people, and you just imbibe whatever you feel is what works. Obviously, there's a that involved in that. You try and you see what works for you. What doesn't, you don't use, and what works, you inculcate that into your daily habits or daily routine. And yeah, I mean, and one last thing is that, I mean, as we all know, the exams are being more clinical. So I mean, being an MBBS student or being an intern, I feel like, okay, the stress is there. I mean, we have to, make sure that we do our entrance preparation part, but clinics is equally as vital. So I mean, a lot of questions are based on what we see, what we do, and what we hear during our, that 5 or 6 years. So we must sacrifice that for one, because both are equally important, and it is, pertinent that we become a good doctor at the end of the day. So I feel like, we must not sacrifice one for the other, and we must, take both hand in hand. So I mean, yeah, that's what I would like to tell to them, And yeah, I mean, everyone's got it in them, so it just takes that fine tuning
That
and
fine tuning. Yes.
that willpower to get through that. Yeah,
Yes. Yes. Yes.
yeah, that's what I would like to
No,
say.
no, Doc, it's been great talking to you, and I would definitely like to
Likewise.
congratulate you once again, and my blessings and my best wishes for a bright, bright career. And keep smiling like this. You got a great smile.
Oh, thank you so much. I mean, it's an honor to be
No, it's
talking
always
one on
good
one
to
with you. And
talking to young, bright, smiling doctors.
okay, okay. I mean, my
Yeah.
pleasure. And yeah, once again,
Yes.
I'm thank you
Yes.
also
Yes.
for
Yes.
being a vital part of this. Yeah.
Thank you. Thank you, Doc. Thank you.
Yeah,
Take care.
it was
Take care,
great.
Doc.
It was great.
Take
Yeah.
care.
Okay.
Okay. Bye.
Okay. Take care,
Bye.
doc.
Take
Okay.
care. Take
Bye.
care. Bye.
I'll see you.
Bye.
Okay.